Hey everyone, in today's video, I'm going to do a review of the emergency nursing residency program that my hospital put. If you want to gain more information about nursing or to improve your nursing in general, please consider hitting the subscribe button down below and giving this video a thumbs up. I would greatly appreciate it. You can also find merchandise like this shirt over here at my website in the description box down below. Check those out. So let's get on with today's video. So in order for you to work as an emergency nurse in British Columbia, you have to do a 4 to 5 month residency program through the British Columbia Institute of Technology. If you get sponsored by your hospital, you still have to go through this program, and every nurse that's specialized in a certain field has to go through this school and obtain a post-bachelor's certificate. In each province in Canada, however, it's a little bit different, and you might want to check out what you have to do for your province in order to work in that specialty field. But in this video, I'll talk about the BCIT emergency program review, and I have a few of my colleagues that I was grateful enough to get their opinions on how the program went. So be on the lookout for those later in the video. So as many of you know, I have been sponsored by my hospital to do this program. Now, what that exactly means is that they pay for your schooling and they pay you during your school in order for you to obtain this certificate. And the program is generally 4 to 5 months, and that requires you to do both an theory coursework online and you have to do clinical sessions, and you have to pass and get above 75% in order for you to move on in the program. There's approximately 4 to 5 courses that you have to do, and it starts with Theory 1, which is an predominantly online course, and then you also have to do dysrhythmia management, which is talks about like ECGs and how to interpret ECGs, and that's also an online portion. Once you have those two, you go into Theory 2 and Clinical 1. Those two are coupled together, and you essentially have to go and do the theory course, like I mentioned, and then you also, on top of that, have clinical portion. So I'll post a picture right here of my schedule, roughly, of what it was like during the first 2 months of Theory 2 and Clinical 1. After that, I got a bit of a break, and it seems like every year they switch it up a little bit, but I got a 4-week break in between Theory 3 and Clinical 2. So during these clinical sessions, you essentially get assigned any hospital in the Lower Mainland, and you have to do your clinical. You have to go and perform the special assessment that emergency nurses have. They have this special emergency nursing framework, which I'll talk about in a later video, and you have to utilize that framework in order for you to assess each patient. So it's a lot different than your ward nursing, and in order for you to pass, you have to effectively be able to utilize that framework and provide different assessments on different patients throughout Clinical 1 and Clinical 2. Now obviously Clinical 2, you get more, they try to put you with more sick patients. You get to go into the trauma room where you have to learn about the trauma emergency nursing framework, and essentially it's a little bit more intense. So I don't want this video to get too long, but I wanted to provide 3 main review points of this program. The first point that I wanted to talk about is the fact that it's very, very intense. When I signed up for this program, I didn't think it was going to be as intense as it was. It was very, very time consuming, and there was a lot of information that you needed to know, and there's a lot of knowledge that you need to be able to absorb, because let's say in Theory 2, where you learn all the different concepts about acute coronary syndrome or shock, you have to be able to apply them later that week in Clinical 1. So the instructors test you on the content of the theory you learn. So that requires you to constantly be studying after your clinical, and really, if you want to be a good emerg nurse, you want to build a strong foundation. So you have to really be studying after your clinical sessions and throughout the weekend. So in the 4 or 5 months that you're in the program, it's quite intense, and there's quite a bit to know. And I kind of got surprised by that. I didn't think it was going to be that intense. And of course, it was during the summer months, so it wasn't the best time, in my opinion, to do the course because you just essentially lost your summer. The other thing I wanted to mention is the fact that there's a shift in the way you assess each patient. I kind of mentioned this a few minutes ago, but essentially that emergency nursing framework, you have to be able to learn it and utilize it with every single patient. And that requires a lot of practice, and it can be sometimes overwhelming for somebody, that's been practicing as a nurse for many, many years, and they have to learn and adopt this new way of thinking. Last thing I want to mention is the fact that the BCIT instructors, both the clinical and the theory instructors, were absolutely magnificent. They were really, really knowledgeable, and they knew all their pathophysiology for all sorts of conditions, and they were able to support you and provide you with feedback constantly on ways to improve your assessment skills in order for you to practice safely but also effectively. That's something that I really appreciate because, in my undergraduate bachelor's of nursing, I didn't find the quality of education was as high as the specialty program. And so when I went through this program, what really stuck out to me was the fact that the instructors were insanely smart, and they were so good at making sure they provided really constructive feedback in a positive way. So they weren't really on a power trip, and they didn't provide you with really harsh feedback. They just essentially provided you with information in such a nice way for you to, try and improve your nursing assessment skills in order for you to practice effectively. And that's something that I really appreciated with this program, was the quality of the instructors, quality of the education, and all the learning material throughout the theory that you learn is actually applicable in your practice. So they didn't teach you stuff and make you read all these articles that were useless. It was so applicable in your everyday practice, which made the education and the course in general, the coursework, more enjoyable, because you knew that if you read that article, you knew that it was going to tie into a patient's clinical situation, clinical setting, clinical condition in some way, shape, or form. So you really had to absorb the material and be able to recite it for certain patients, and that to me was really, really interesting. So overall, I found the program very, very well done. By the clinical 2 and theory 3, that was really intense because mine was 4 weeks and they shortened it because I think this COVID pandemic sort of situation made it a lot challenging for them to, find the best scheduling for things, and they really wanted to have it shortened to have us practice, because obviously there's a lot of shortages of nurses in general, and then let alone the specialized nurses. So they did a really good job. It was very intense, and I overall am very grateful to be a part of such an amazing specialty and an amazing field of nursing. So I wanted to provide you with my friend Andrew and Miguel's experience on the emergency nursing program. The first video is probably going to be of Miguel, who both him and I were in clinical 2, and we both did the specialty program, and that was the last day of our clinical. So here's him giving his thoughts on the program.
So now we just finished clinical 2, so now we're baby ER nurses. So what are your thoughts on the whole emergency certificate, the whole program, and everything in general?
Dude, look at my smile right now. No, I just feel so free. I just feel like I had so much weight on my shoulders, and now I could finally let it go. And I just feel so good right now. This is our last. I'm walking home to the car with SAP right now. We're just so happy. We're very thankful, what we learned and experienced with our instructor and classmates and other staff there. But it's been a crazy wild ride. Mm-hmm. I mean, it was very challenging. It was very tough, but in the end, when you look back, it's like we learned so much. Like, it's just such a short amount of time. Mm-hmm. We're in that BCIT ER specialty. I think that's only BC, but it's pretty intense. I mean, it's such a condensed amount. Just the time is just so condensed, and then so much to learn, and just glad to be, I'm glad it's over with, and we just work our butts off every day. You know, it's super hard work. Seriously, I've never worked so hard in my life. And yeah, it just feels so amazing right now.
For sure. Do you have a newfound respect for emerge nurses now?
Oh, of course. Yeah, I've always respected them, but it was more of just like a mystery. I didn't really know what they
Yeah,
did
for
behind,
sure.
right?
Yeah,
so
yeah.
it's just like what you see in the movies. But once you're there, it does feel like a movie. Like things are happening, things like people are bleeding like crazy, and you know, you just kind of, the program really teaches you how to kind of look at the important things and pretty much just be more confident and assert yourself. Don't be so panicky. So yeah, I just learned so much. So
Did you overall enjoy the experience and working with teachers, clinical instructors? They were all good. You had good experiences?
for sure, yeah, a lot of them good experiences. I mean, a lot of them were hard, but it was necessary for me to kind of, you know, grow as a person, and just interpersonal relationships. Like, you know, just so many people touch me in different ways that I'm kind of really inspired, you know, by everybody has their own strengths and their personal approach, their knowledge. So you just take so much like good things from other people and inspires you and just motivates you to be a better person in different aspects, you know.
Yeah,
deep.
it for sure. Like they definitely push you to learn more. Well,
Yeah.
thanks Miguel for your time, and
Yeah,
I hope
thank
to
you.
work with you after today one
For
day.
sure.
And then this is Andrew after our ACLS training that we finished. So at the end of the program, they train you for BLS and ACLS. And at the end of our ACLS, thankfully we both passed the ACLS. Here's Andrew giving his thoughts on the program.
Andrew, so
Hi.
we just finished ACLS, and last week we finished the emergency nursing training. How did you think the program was?
Oh, all in all, it was really good.
Did you find that it was intense at times? Was it harder than expected? How did you feel the clinical and the theory went together?
It was super busy. It was really condensed, yeah. We did it a little bit shorter than other people, so we went down to 4 weeks instead of 6 weeks for clinical 2. I felt overall it was manageable. Like the content can be challenging. Clinical could be challenging with your instructor always kind of giving you the grill after every time you had a case, but that's also what made it such a good program.
Thank you so much for watching this video. If you thought it was valuable to you or if you learned something, please give the video a thumbs up. In my later videos, I'll talk about tips I have, recommendations I have for someone going through the emergency nursing program. And please be sure to check out the merchandise I have down below in the description box. And please consider subscribing. I try and upload a video every week, but sometimes when I have very intense programs that take up a lot of my time, it can be challenging doing that. Anyways, guys, I'll catch you in the next video.